Good afternoon. Welcome, Ally Podcast members and friends. Today is the CathCast, and we are doing a CathCast takeover with Leah Holderbaum. Our normal facilitator is going to be in the hot seat today answering some questions. Hello, Leah.
Hello. I am pumped to be here. I'm excited for this takeover. Should be fun.
It's a fun topic, a topic that nobody probably woke up and thought they were going to want to listen to about today, but we're going to get into it. The topic today, our discussion is around transanal irrigation. My words for it always, an enema on steroids, but there are definitely some more clinical terms behind that. So we're going to have a quick discussion today around what it is, who it's good for, where we think the future of it is, and really specifically geared toward any clinician who's watching this. So, Leah, would you tell our guest what transanal irrigation, or for the purposes of this podcast will be TAI, what is it? And talk to us like we're in middle school.
Yeah, absolutely. So, transanal irrigation is a method for bowel management, and it is an alternative solution for individuals whenever conservative measures have failed. Conservative measures means, diet and medication modification, or using digital stimulation and suppositories. So whenever someone is not having an effective bowel management program, transanal irrigation, or TAI, is another option for them. And so what they would do is they would get the unit, and using either a rectal catheter or a rectal cone, it is inserted into that rectal vault, and that allows for irrigation. So water is going to go up into the intestine. It is a kind of like a manual pump system, and it goes further up into the intestine than, say, a standard enema. So it's actually going to pull out more stool than what a regular enema or a standard bowel program would do. So it allows for more full evacuation, and again, it's just a different alternative for a bowel management strategy.
Great explanation. So for the viewers, this particular device has been around for quite some time. When did it come out, Leah?
It was many moons ago, but it wasn't until the 90s that it was actually accepted by people.
And there's a certain patient demographic it was created for, and will you share what that is?
Yes. So transanal irrigation was originally designed for individuals that have spina bifida, and the intent was that it would help them have better control over their incontinence and or manage their constipation, and ultimately give them a better quality of life. So it was specifically designed for individuals with spina bifida.
So there's a lot of talk about it recently, just because in 2025, the device was finally given a HCPCS code. So that means it's going to be reimbursed by more insurance, and the access is open. So there's a lot of chatter. There's a lot of resources being put into the manufacturing side, into the distribution side, to the teaching side. So there's a lot of chatter around it, but it has been around for a while. I would love for you to share with our audience how you felt about transanal irrigation a year ago.
So I will be the first to hesitantly admit that I was not a fan of transanal irrigation. With my background as an occupational therapist, I was of the belief that conservative measures worked. I came from a model rehab for spinal cord injury, and I had convinced myself that suppository digital stimulation was going to work perfectly fine, and we didn't really need another alternative. And it wasn't until very recently, just the start of this year probably, when I started doing more research on bowel management and transanal irrigation, that I really started to understand the significant impact that it can make for individuals. And it's not for everybody, but for the people that have success with transanal irrigation, it is ultimately life-changing. Whether someone has, let's say, a high-level cervical injury and they're struggling with constipation, transanal irrigation is going to soften and help to remove the stool that is within that colon. So it's going to help them feel better, ultimately eliminate, the potential for autonomic dysreflexia, allow them to participate in more daily life. Whereas on the other side of things, someone with, let's say, spina bifida or a lower motor neuron injury. If they have a lower spinal cord injury, they might have lower motor neuron, where they are going to be more prone to accidents. And if someone is more prone to accidents, they are not going to participate in daily life. They're not going to go out in the community. That's going to take up time for, cleaning the accident and having to get, back onto their schedule. So for these individuals that have these issues of chronic incontinence, chronic constipation, that is going to be the primary target that can benefit from transanal irrigation. So again, I'm a firm believer in there is something out there for everybody. TAI is not for everybody, but for individuals that have trialed it and have success with it, it is a ultimate solution long term.
So paint a picture for us what success would look like.
What success looks like, yes. So what success looks like when it comes to bowel management is it needs to be consistent. So the person can anticipate around the same time every day when they need to evacuate their bowels. They're not having accidents. They know when it's going to happen, and they have some sense of control over it. The idea also, we want to make sure that they aren't, we don't want to have a ton of medications, a ton of equipment, a ton of gadgets. So let's make this as simple as possible, and what's going to be the most conducive for that person's lifestyle. And then lastly, we want to make sure that their bowels are managed, that they are staying healthy, they're not having accidents, they aren't constipated, they aren't at risk for autonomic dysreflexia, skin breakdown, UTIs. So ultimately, that's the realm of what success looks like. Someone has control, no accidents, no constipation, no AD, and they're just healthy and able to participate in daily life.
So how many manufacturers are on the market today?
Currently, there are 3. There are 3 units that are available on the market right now.
And what, without disclosing their names, like, can you say what one unit has maybe different from another unit, or?
Yeah, I think, so again, much like with catheters, all of the units are very, very similar. They're all just a little bit different when it comes to features and benefits. Some of the considerations are looking at if the units come with rectal catheters, rectal cones, or can you choose? There are different clinical indications for a rectal catheter versus a rectal cone. And that could have to do with, the clinical presentation, or it could have to do with the individual sensation, their dexterity, their functional skill set. But ultimately, it's going to come down to, does the person want a cone or a rectal catheter? And also, just looking at their functionality, for example, let's look at their dexterity. Do they have the dexterity to potentially, pump the manual pump for the air or for the irrigation? Do they have dexterity to, turn the dial for air or water? So again, they're all very, very similar, just a little bit different when it comes to features and benefits.
Nice. So if there are clinicians out there watching this and their interest has been piqued by what you've shared, what would the lift look like to be if I'm a clinician and I have a population that might benefit from it? Like, am I signing up for a bunch of training? Who trains these customers and these patients on it? Is it going to be a time, basically it's not going to be billable hours if I'm putting someone on it. So unfortunately, I know everyone's thinking about that. So kind of describe what that, like, onboarding of a patient customer for us looks like.
Yeah, ideally, when it comes to clinicians, PTs, OTs, nursing, case manager, whoever it is, the bowel program just needs to be identified. It just needs to be recognized that whatever the person is currently doing is not working for them. They are still constipated. They are still having accidents. They are having episodes of AD, so on and so forth. So once that person is recognized, all that needs to happen is the individual can contact their local New Motion medical supply account manager, and we can get in contact with the manufacturers. So we'll do all of this stuff behind the scenes, but the lift for the clinician is just to recognize that there is a need there. With these manufacturers, many of them do provide their own clinical training and their onboarding with these individuals, because this is a minimally invasive bowel regimen. And so we want to make sure that they have ongoing clinical support. And, that's something that we unfortunately cannot provide. So we make sure that that is set up with those manufacturer partners. Other than that, there are some, one manufacturer specifically works directly with the clinic, and that clinic would provide the training. So, in summary, the lift for clinicians is just to recognize that, hey, this bowel program isn't working for whatever reason. Would TAI potentially be beneficial, and then contact their new motion counterpart?
So it sounds pretty easy.
Super
Outside
easy.
Yeah.
Hey, I'm Dylan from Wheelin' with Dylan.
And I'm Leah with the CathCast. If you're listening to this, you are already part of the conversation, but there's a lot more to explore inside New Motion Medical Supply's Ally program.
And all our podcasts live there too. So if you want to catch past episodes or get the earliest access to new ones, that's where to go.
And the podcast is really just one piece. Inside Ally, there's a full library of articles, webinars, and short videos focused on bladder health, catheter use, and building routines that work for you.
It's also a great place to see how others are navigating things day to day. Real setups, real experiences, and things you might not always hear in a clinical setting.
And a big part of that is the community forum. There are sub-forums for different experiences and stages of life. So whether you're just getting started or have been doing this for years, there's a space for you.
You can ask questions, share what's worked for you, or just read and see how others are handling similar situations. It's a really easy way to connect and not feel like you're figuring everything out all on your own.
It's simple to access. Absolutely anyone can explore these online resources or set up a free Ally program account to unlock exclusive features. Just enter your email and verification code and you'll be connected to educational tools, real stories, and community support right away.
It's completely free, and everything's in one place at catheters.newmotion.com/ally.
Head to the Ally program today and join the conversation.
We'll see you there.
So with you being an OT in this space before, I am interested in how you think an OT's role kind of plays and partners in with like a doctor, with a patient, or with a nurse in the realm, all the different disciplines that are interactive. Like, what would an OT's role be in the group?
Yeah, so anytime you're addressing anything, bowel and bladder management, it has to be interdisciplinary. It has to be collaborative. And I'll speak just from the OT side, but as an occupational therapist, some of the things I'm looking at are initially dexterity. Can they manage their suppository? Do we need to look at adaptive equipment? I'm also looking at, what type of bathroom equipment they're on, looking at their ability to transfer onto that equipment, but also considering the potential wet, bare bottom, exhausted transfer at the end of the bowel program in the shower. I'm also working on, clothing management. I'm trying to determine their home modifications for their bathroom setup. And that being said, it really has to be collaborative. I'm working with my PT partner on balance and transfers and determining the appropriate equipment. And when it comes to specifically TAI, I might be looking at, potential modifications for the device. Where's the person going to hold or position the device when they're doing their bowel regimen? Does the equipment that they're on, does it need to be modified? Potentially looking at a different seat cutout, looking at if it's on, if it's a front cutout, do we need to look at a cutout on the right so that they can be independent? There's a lot of different things that we're looking at, the environmental setup, their cognition. So it really is a very holistic approach. And as an OT, if I didn't have the support of my doctors working on prescriptions and medications and managing the clinical piece, or my nurses to help carry it over, my PT counterpart, it would not be effective whatsoever. So it has to be every individual working together for the outcome for the person.
Do you have any success stories? Have you read of any patients or know of anybody in this brief time we've been engaged that have had these, like, basically something that could be relatively life-changing for them?
Yes. So I actually had a friend, and they've been injured for quite a long time. It's been over 10 years, but this individual has struggled with chronic constipation forever. This individual has female anatomy, and so having constipation, having female anatomy, she was also having increased UTIs. There were a lot of things, a lot of health risks that were going on with her. She was also having increased episodes of autonomic dysreflexia because she was constipated, having UTIs. It was just this vicious cycle. And it wasn't that long ago. I will probably maybe 6 or 7 months ago, I believe, she started trialing transanal irrigation, and she has lost weight. She has had decreased episodes of autonomic dysreflexia. She is back in the gym. She is traveling all over. It actually allowed her to get a brand new job because she didn't have to be so overly focused on her bowel program. So now she has this brand new career, and it made a significant change in her life. Is just the short of that.
We love a good success story. Oh.
Yes.
Okay, so what misconceptions are out there about TAI that you wish people more understood?
And I'll speak to my own misconceptions. One of them was that a rectal catheter and or potential, rectal cone could cause significant trauma and or injury. And I have since learned that is not fully true. It really comes down to the technique, the lubrication, and ultimately someone is going to be at as much of a risk for injury if they're inserting a finger into their rectum or using a digital stimulator or a suppository inserter. So that is one misconception. Another one that I've heard a few times is that, and I also believed this, that autonomic dysreflexia would be a prime result of using transanal irrigation. And I actually had a friend of mine share some research with me, and it completely changed my eyes, and it's been something that I've shared with anyone who will listen. But when it comes to autonomic dysreflexia, TAI has been shown that if someone does go into an episode of AD, that episode is less severe and it lasts a significantly shorter amount of time compared to standard bowel treatment programs. So if you think about, bowel and bladder are typically the primary causes for autonomic dysreflexia, whereas if someone does go into an episode, if they aren't using transanal irrigation, but it takes, an hour to an hour and a half or longer for their bowel program to take effect, that is that hour and a half that they are going to be enduring those symptoms, and they are going to be feeling not well at all. Whereas if they use transanal irrigation, they can be done in 30 minutes. Symptoms will start to subside and they'll be able to start recovering once that has concluded. So I would say those are probably the two biggest misconceptions. And I can say that because I was absolutely guilty of both of those. It's the injury, the trauma, as well as autonomic dysreflexia.
What about the one we've heard a few times of the thought that it weakens the colon?
I have heard that talking about how it weakens the colon, and I think it's important that at the end of the day we're looking at the type of person and the clinical presentation for them. For example, if someone has lower motor neuron, they are not going to have any pelvic floor reactivity whatsoever. There is not going to be any reflex. There's not going to be any ability to tighten those muscles, clench those muscles, no sensation. And so that colon is basically already weakened in and of itself. So it's not necessarily the same concept. A lot of times, we would compare it to a Foley or an indwelling catheter where you have that balloon in place and it's just allowing for continuous drainage. Transanal irrigation isn't like that. It goes in, you would irrigate the bowel, and then you would remove it. So it's not something that is consistently staying in. But what's great about it is it removes the stool from that descending colon. And so someone, they're typically free for about 30 hours. So it does give them a significantly longer time that they're going to be able to participate. But yeah,
Cool.
That would be my thought.
Kind of one final question here. What do we think the future is going to be for TAI?
I have no idea. I would love to be able to try to compare it with catheters. Right now there's only 3 units on the market. I would not be remotely surprised if down the road, if there are more units. I also wouldn't be surprised if there are more options compared to, like I mentioned right now, some units come with cones, some come with catheters. There's only one that has both that are available. So I wouldn't be surprised down the road if all of these units offer cones and rectal catheters. Definitely, I see a lot of change for the features and benefits. As this is becoming more utilized, I see some functionality being tested behind it and making it more conducive for individuals that have different, whether it's dexterity concerns or, visual impairments. I see some other things happening with that in regard to features and benefits. Hopefully.
I'm sure it will evolve, from what it's been in the past 40 years already out there.
Oh, so, yeah, it's just going to continue to change.
Yeah. I mean, the first thing that always changes the color, I want a pink one, I want a green one. So.
And I wouldn't be surprised too, like if, down the road, if they come up with something that's a bit more compact, like they're already, fairly small units anyway, but just thinking for like travel or, who knows? I'm here for the journey. I'm excited for it. I think it's going to be great.
Put in the suggestion box for all the manufacturers, travel size, TAI, please.
Absolutely.
Yeah. Mm-hmm. Well, Leah, thank you for letting me take over your podcast for this really exciting new topic. And I think we'll have more discussions around this in the future. Yeah, is there anything you want to share with the audience before we release back your podcast to you?
No, I would just, encourage anyone out there who's listening, explore all options and do research and know that, just like with, therapy and medications and home exercise programs, Bowel program is not one size fits all. TAI is not destined for everybody, but for the person that can benefit from it, it can be significantly life-changing. So be open, learn what you can, and it took me convincing, but go in with an open mind, and I think you'll be excited at what you can learn about it.
Thank you again for sharing.
Absolutely.
Thank you
Absolutely.
Ally friends and community for joining us today.
Absolutely. Thank you all so much.